Have you ever experienced a sudden back pain that made you sweat and unable to stand? It is likely not a lumbar problem, but a kidney stone. Kidney stones may sound small, but they can cause big trouble. Not only is it excruciatingly painful, but it is also very easy to recur. Today, we will have a systematic and in-depth analysis. What exactly are kidney stones? Why do you get them? How to prevent and treat them? After watching this episode, you will master the most practical stone prevention tips. Part 1. What are kidney stones? Kidney stones are like mineral crystal bombs in urine. When the concentration of minerals and salts in the body is too high and you drink too little water, they will begin to crystallize and gradually turn into hard stones. This is the origin of kidney stones. Part 2. 5 types of kidney stones and their characteristics. 1. Calcium oxalate stones. Calcium oxalate, accounting for 70–80%, is the most common and is related to high oxalate foods and dehydration. 2. Calcium phosphate stones. Calcium phosphate, accounting for 5–10%, alkaline urine, related to metabolic abnormalities or hyperparathyroidism. 3. Uric acid stones. Uric acid crystals, accounting for 5–10%, are related to gout, high purine diet, and abnormal uric acid metabolism. 4. Infectious stones. Magnesium ammonium phosphate, accounting for 5–10%, caused by urinary tract infection, can grow rapidly and form antlers. 5. Cystine stones. Cystine, accounting for less than 1%, is rare, originates from hereditary diseases, and has a high recurrence rate. Part 3. Causes and high risk factors of kidney stones. Root mechanism. Urine concentrated crystals deposit stones. High risk behaviors include not liking to drink water, loving to eat spinach, chocolate, red meat, seafood and other high oxalate and high purine foods, liking heavy flavors, high salt diet, obesity, metabolic syndrome, frequent urinary tract infections, gout, hyperparathyroidism or cystinuria and other basic diseases. Part 4. Warning signs of stone attack. You may feel severe cramping on one side of the waist, renal colic, blood in urine, nausea and vomiting, frequent, urgent, and painful urination, turbid or odorous urine, fever and chills. Infectious stones. Part 5. The most practical prevention strategy. General golden rule. Drink enough water every day. Ensure urine volume of 2–2.5 liters. Limit salt. Daily sodium intake of 2,300 milligrams. Do not consume too much protein, especially animal foods. Eat more lemons and oranges containing citric acid. Do not blindly reduce calcium, but moderate intake can prevent stones. Reduce high oxalate foods, such as unblanched spinach and nuts. Control weight and improve metabolic status. Part 6. Comprehensive analysis of treatment methods. 1. Conservative treatment is suitable for small stones less than 10 millimeters. Drink a lot of water. Painkillers, such as tamsulosin, help expel stones. 2. Interventional treatment for stones larger than 10 millimeters or complicated conditions. ESWL lithotripsy. The full name is extracorporeal shock wave lithotripsy, which is a non-invasive medical technology commonly used to treat kidney stones and arterial stones. It is suitable for small stones less than 2 centimeters. ESWL uses high-energy shock waves generated outside the body to focus on the stones in the body. The shock waves pass through the skin and soft tissues, releasing energy on the surface of the stones, causing the stones to be gradually broken into small fragments, and then naturally excreted from the body with urine. ESWL is one of the preferred methods for treating small kidney stones. It is non-invasive, safe, and has a fast recovery, but it requires good post-operative stone removal management, such as drinking more water and exercising appropriately. B. Arteroscopic lithotripsy. It is a minimally invasive treatment method. The doctor uses a thin endoscopic arteroscope to enter the urethra, pass through the bladder, and then reach the ureter or even the renal pelvis. Then, a laser, usually a holmium laser, is used to accurately break up the stones. After that, the small fragments will be flushed out or removed, and eventually excreted from the body with urine. It is suitable for stones that are usually less than 2 centimeters in size, but skilled people can handle larger stones. C. Percutaneous nephrolithotomy. Percutaneous nephrolithotomy is a minimally invasive surgery that is mainly used to treat kidney stones larger than 2 centimeters or complex shapes. The doctor makes a small incision of about 1 centimeter on the patient's back skin, punctures into the kidney under image guidance, and sends the endoscopic nephrolithotomy to the location of the stone through this channel. Then, an ultrasonic or laser lithotripsy device is used to break up the stone and remove it completely. D. Open surgery. It is a traditional and more invasive surgical method. The doctor needs to cut the skin and tissue on the patient's waist or abdomen to directly expose the kidney or ureter, and manually remove the stone completely. Although it is now replaced by minimally invasive techniques such as ESWL, ureteroscopy, and PCNL as the mainstream treatment method, open surgery still has an irreplaceable role in some extremely complex or failed cases. Open surgery is the last line of defense for stone treatment and is suitable for patients with complex deformities and giant staghorn stones who are ineffective with other methods. Although it is more traumatic, it is sometimes a key means to protect the kidneys and save lives. Part 7. Dietary recommendations for different stones. 1. Calcium oxalate stones. Sufficient calcium, limited oxalic acid, high water content, and limited salt. 2. Uric acid stones. Eat less red meat and offal, alkalize urine, and eat more fruits and vegetables. 3. Infectious stones. The focus is on controlling urinary tract infections. 4. Cystine stones. Drink a lot of water, alkalize urine, and use medication when necessary. Part 8. Long-term follow-up should not be ignored. Analysis of stone composition. Understanding the cause is the key to prevention. 24-hour urine test to evaluate metabolism. Recommended for recurrent patients. Regular imaging examinations, ultrasound or CT. Adhere to dietary adjustments and lifestyle management. Conclusion. Remember this sentence. Although the stones are small, the pain is huge. The best treatment is to prevent it before it happens. Drinking more water every day can not only clean the intestines, but also clear stones. Finding out your stone type is the first step to truly start a healthy life. Pay attention to health, starting today. Let us stay away from the pain of kidney stones together. Thank you for watching. If you find this helpful, please like and share this video to help more people protect their kidneys. Subscribe to the video for more scientific health insights. See you next time.